In this part of Chapter 7, we're going to discuss abnormal urine crystals. This is used with permission from Dr. Kathy Parks. In discussing abnormal urine crystals, these are always clinically significant, and you should not report them haphazardly. Abnormal crystals are rarely encountered, and they should be reviewed by the supervisor and/or the pathologist for confirmation before reporting out. These are the 4 abnormal urine crystals we will be discussing: cysteine, tyrosine, leucine, and cholesterol. Cysteine crystals are probably the most important of the abnormal crystals of physiological origin found in the urine. They are seen in the patients with the metabolic disorder cystinuria. This is an inherited amino acid transport disorder affecting cysteine, ornithine, lysine, and arginine. They have the inability to reabsorb the cysteine. Because of this, cysteine crystals are seen in the urine. Patients with cystinuria are more likely to form cysteine stones, and this can then cause kidney damage. If the cysteine crystals fill up the renal collecting system, then the stones can look like staghorns. This will cause renal stasis and will be required to be removed by lithotripsy and possibly surgery. Lithotripsy is where they try and use these really intense vibrations to break up the stones so they can pass. But if not, because they get stuck, surgery would be required. Cysteine crystals appear as colorless and refractal hexagonal plates. They're similar to uric acid, so you need to distinguish between the two. The ability to polarize light depends on the thickness of the crystal. The cysteine crystals, again, can be confused with uric acid. Like uric acid, cysteine crystals are insoluble in acid pH. The clinical significance is the crystals present in congenital cystinosis or congenital cystinuria can cause issues and damage to the kidneys. The crystals can form calculi or stones. Tyrosine crystals in urine are very rare, but they may occasionally be seen with leucine in urine from patients with severe liver disease. They are present in acidic urines. Their appearance is very fine, delicate, pointed needles. The needles may be dark brown or black in color. Their aggregates are as a cluster, and they will polarize light. The clinical significance is it may indicate a metabolic disorder called familial tyrosinemia. It's also, again, present in severe liver disease. Tyrosine is seen in the urine of an acidic pH. Leucine crystals are extremely rare, and they're associated with severe liver disease and certain rare hereditary disorders of amino acid metabolism. They're usually seen together with tyrosine. Leucine crystals are usually yellow, oily-looking spheres. They're highly refractal. They reflect the light. They resemble grapefruit sections. And the most classic characteristic that you will hear is they will produce Maltese cross patterns when they're polarized. The clinical significance, again, they're found in patients with maple syrup disease, which is a hereditary disorder we'll talk about later, and serious liver disease. Bilirubin crystals are another rare crystal, and what they are is precipitated bilirubin. You should expect a positive bilirubin on the dipstick if these are present. The sediment, when you spin down the urine and see the sediment at the bottom of the tube, may be stained a dark yellow. The appearance of these crystals, they may be clumped granules or needles. They'll have that orange-yellow color, and they're usually present in patients that have viral hepatitis with tubular damage. Cholesterol crystals form an acidic pH, and these are free fat from the degradation of renal tubular epithelial cells. They may be seen in fatty casts and nephrotic syndrome. They also may be seen in refrigerated specimens. The appearance under the microscope are rectangular plates with characteristic notched corners, and they're highly birefringent. You can see in that bottom picture just the multitude of colors. Oval fat bodies, when renal tubular epithelial cells undergo fatty degeneration or have absorbed lipid in the filtrate, these oval fat bodies may form. The lipid droplets are within those renal epithelial cells that are breaking down. Some of the lipid-containing cells may also be macrophages. When using a polarized light, a Maltese cross formation may be seen, so you don't want to get these mixed up with the other crystal that has the Maltese cross. We're going to talk about some other formed elements that may be found in urine, and yeast is not uncommon. The most common yeast that is found in urine specimens is the genus and species Candida albicans. This may be the result of vaginal contamination with a vaginal yeast infection. Sometimes, though, they are often the result of contamination from skin and air. Diabetic patients with glucose in the urine may have yeast infections. Yeast may also be in the urine of immunosuppressed patients who have true kidney infections. Yeast have a typically ovoid shape, they're colorless, and they have a smooth refractal appearance. So when you focus up and down, they refract the light. They can look like red cells, but they are smaller in size. And what you want to do is look around and look for budding yeast. And you can see on the left and right hand are pictures that these yeast have grown so large they are the filamentous form. There are some parasites that are indigenous to the urinary tract, but many times the parasites that are present in the urine are as a result of vaginal or fecal contamination. There are no chemical tests that can determine whether or not parasites are present in your urine. White cells may be present. And in this picture on the bottom left, there's Enterobius vermicularis, also known as pinworms. And these lay eggs at the anus, so if you don't wipe in the correct direction, you can get urine contamination. The bottom one is Schistosoma hematobium, which is a kidney parasite. And on the top is Giardia. It's not a very good picture, but this is also a fecal contaminant. Some other abnormal urine crystals are called iatrogenic in origin, and these are supplements or pharmaceuticals that can crystallize when it's eliminated from the body. For example, some supplements such as ascorbic acid, pharmaceuticals, which are medications like salicylates, ampicillin crystals. These ampicillin may form colorless needles when they're refrigerated, and these crystals are seen when the patient's receiving high dosage and decreased hydration. Another type of pharmaceutical crystal is that due to sulfonamide. These are found in acidic pHs and may appear as yellow-brown needles. Those needles may cause renal damage. They do polarize in the light. Crystals of radiographic contrast media may be seen in the urine of patients for a brief amount of time after an injection of the dye. They must be differentiated from cholesterol crystals as they can be similar in appearance. On occasion, they can be clinically significant, especially in elderly patients that are dehydrated and who may be experiencing renal blockage because these crystals have precipitated out in the kidneys. The presence of these crystals can be checked knowing the patient's history. As a student, one of your biggest challenges will be differentiating artifacts from real elements in the urine. Artifacts or junk may be seen. Starch is seen as a refractal, round, or oval and will polarize with a Maltese cross. Talcum powder crystals can be seen, and the photo below the Maltese crosses is an example. Another problem can be glass fragments if you're using glass slides instead of the Cova slides. Air bubbles are always fun, and sometimes they'll have this distinctive black round appearance. So you want to be very careful when you put your urine on the slide that you don't get air bubbles. Oil droplets can cause problems when reading the urine sediment, and this is the reason you need to keep your microscope objectives clean. Fecal contamination is not your fault, but you need to be sure that patients are aware that they need to not contaminate the urine with feces. If it is detected, then the sample needs to be recollected. Here are some references for additional information about this topic. As always, Write down your questions, research them, and if you can't find answers, ask your instructor.